Good afternoon and welcome to this week's Small Business Town Hall. Once again, this is Sabina Matos. I'm the Lieutenant Governor for the state of Rhode Island. I'm so glad to be able to join you this week for the Town Hall. And also I want to thank Chris Parisi for picking up last week, making sure that we continue to have this conversation weekly. Chris continued to do a great job keeping us all informed and making sure that the Facebook Lives continue. Make sure that you follow at RI Small Business to get all the information. We're continuing to come through the other side of the pandemic, and we're switching from our programming and having updates on other things that are available, federal, state, community partners, and more detailed discussions for our small business community. So now I just want to move to our discussion. Today, we're going to hear from Mark Hayward, Director of Small Business Administration from the state of Rhode Island. We're going to hear from Director Matt Weldon from the Rhode Island Department of Labor and Training. Chris Parisi, of course, the founder of the Rhode Island Small Business Coalition. And we're going to hear from Director Lindsay and Kristen Areson from the HealthSource RI. So, and also Ashler Schofield, the owner of Frog and Toast, is going to give us an update about how they were able to go through last year with the pandemic. So we're going to be hearing a lot of good information. But first of all, we're going to start with Mark. Mark, let us know how things are going. Director Mark Hayward from
How are you, Governor? It's good to see you.
So good to see you. I missed you last week.
I know. And I put on a tie for you this week, by the way.
Thank you.
Which is probably the first time I've put on a tie in a very long time. So we've been very active. I want to give you some updates on, because I know that there are a lot of questions out there about the Restaurant Revitalization Fund. Just FYI, we have run out of funds. The $28.6 billion has been expended. I believe that there is a reserve of approximately $200 million, but the agency also has been enjoined by the Eastern District of Tennessee and the Northern District of Texas by two federal judges on some technical issues. But for Rhode Island, there was approximately 450 restaurants that were funded, Governor, for approximately $105 million, which I think is significant. I know that there are a lot of additional people who are also in the mix who did not receive funding. I do know, and you know, our recommendation is reach to the congressionals. We can only go as far as the appropriation level has been provided to us, and then, you know, and I'm not going to opine on whether it's good, bad, or indifferent for additional funds, but the agency has been in dialogue with both the majority and the minority on both sides of the Congress as it relates to the Restaurant Revitalization Fund. But I just thought people would want to know, 450 restaurants, Governor? That's pretty significant.
It is. Yeah.
There's also been a lot of questions about the shuttered venue operating grant, and I pulled down a report that I actually got this morning, and there are 9 approvals in Rhode Island as of now. The Barrington Arts Alive got 82,000. The Gateways to Change DBA Artists Exchange got 105,000. The Odeum in East Greenwich got 379,000. The Middletown Arts Management got 52. Newport Playhouse got 529. The Gallery Events in Pawtucket got 43. The Met in Pawtucket got 171. The Archetype in Providence, which is in Oneyville, Governor, got 472. And the Sandra Feinstein GAM Theater in Warwick got 276. Now, there are a lot of people who are not on that list, and I don't want people to misunderstand. The agency continues to process those. We have had some discussions with people who have called us about those. So we want people to know that their processing is still going on, and hopefully they'll be hearing soon. The other thing is we went and did some analysis of the Paycheck Protection Program from a credit union standpoint, because credit unions have been very responsive to people in the communities of color, to women, to veterans. And it's really interesting, the information that credit unions really played a significant part in the state of Rhode Island. And I just want to give you round one and round two numbers of the 5 credit unions that were on top. So round one, Navigant Credit Union approved 1,159 loans for $82.6 million. In their second round, they approved 680 loans for $50 million. The Pawtucket Credit Union approved 359 loans in the first round for $23.4 million. And then in the second round, they approved 326 loans for $15.4 million. Greenwood Credit Union, which is a one-based credit union, approved 186 in the first round for $19.2 million, and then 127 in the second round for $8.3 million. People's Credit Union out of Middletown and Newport approved 171 in the first round for $6.4 million. And they were the only ones that approved more in the second round than they did in the first round. They approved 179 for $6.3 million. And then finally, Westerly Credit Union approved 125 in the first round for $5.3 and 107 in the second round for $3.1. Why do I mention this? Because I think it's important, Governor, for people to understand that you have options and that the credit unions really played a significant role. And we're going to do some analysis on some of the other lenders in Rhode Island, but those are the ones that we just pulled up this time. And the other thing that, while I know that there are no grant programs currently in existence that people can apply for, I do know the fact that we're talking about navigators, and there are a number of establishments. We had a meeting where I think there were about 25 people, including Chambers of Commerce, Rhode Island CPA, Marianne Matthews, who I know you know very well, as well as Lisa Ranglin and Oscar Mejias and a number of people. We're talking about how does Rhode Island respond to the request for a navigators grant request. So we had a good discussion on that, and I know that they're proceeding forward. So I just wanted to bring you up to speed on that, and hopefully, I think yesterday they told us that the deadline was extended to July the 19th for all applications to be in. So, but we're looking. This is a future. We're looking at how do we serve communities of color, women, minorities, as well as the general population. And the one thing that I stress to them, Governor, is we not only have to look at those populations, but we have to look as a state as a whole, because we're small. And I think by working together with all of the chambers and all of the groups, we will have a navigators program that will be second to none. As it relates to, we still have the 7A program, which is a general loan you can get for machinery, equipment, land and buildings, or working capital. And the agency has, according to what they tell us, sufficient amount of money to do what's called Section 1112 payments. That means, Governor, if you get a loan today, we will pay 3 months of that loan.
Oh, wow.
And you will not pay fees, and neither will the bank. So that money will run out in September, at the end of September. But we are told that there are sufficient resources in the pot for people to apply. So if you're in need of a working capital loan, definitely do that. Now, on the issue of economic injury disaster loans, I know that a lot of people have asked about the grants, the Advantage grants, and I know that they're flowing out. But the people who are at 150,000, who are looking to go up to 500,000 from a loan perspective, and these are loans for 3 3/4%. My deputy Joan and I have gone into the system, God knows how many times, but there are issues with getting the verification of the IRS returns, which is the 4506T, and the agency has to get those. And it's not only people in Rhode Island, it's across the country. It is taking time. We had a very serious conversation with our Office of Capital Access yesterday, saying, what can we do to expedite this? And that is an issue that's currently outstanding. Governor, I'm hoping that we get some feedback by next week, because I understand the frustration of many. We've heard it. And some people, they're being told it could take anywhere from 6 to 8 weeks. And we know that there is a need for that money to flow as soon as possible. So when people contact us, I just want them to be aware. We're aware of the situation. We're advocating on your behalf. And I think for the very small staff that we have, Governor, I think we've done yeoman's work. And I want to compliment my staff because they have been absolutely phenomenal. And I see Ben has put our email address up. If you got a problem, send it to that email address. The other thing, Governor, is I'm still concerned about hospitality, small retail. The staff, with 2 members of my staff and I are going over to Block Island to talk to the chamber and to the tourism council because they're impacted. Most people are still going to Block Island. I mean, now that we're, kind of open for business, but they do not have the sufficient numbers of people to work in those establishments. And we know that they're challenged by that. And, but we're going to go to Block Island on Thursday, Governor. If you got nothing to do, you can always come with us.
I was going to tell you, Mark, I haven't been to Block Island yet, and I have to visit my 39 cities and towns. So I was waiting for the governor, but maybe I'll go with you. So send me the info.
I will. Because we want to talk to the business people. We want to make sure that we're responding to what they need. And I know that there's a lot of PPP out there. So anyway, that's where we are today, Governor. It's great to see you.
It's great to see you, Mark. And also, I want to join you in saying thanks and congratulations to your staff for the amazing work you all have been doing. Thank you, thank you, thank you. You have been helping our business community to get through this pandemic, to survive. And now we're moving into the stage in which we want them to thrive. And you're helping to make that possible. So thank you to you and your team. Okay?
I agree. And there's not many people I put a tie on for nowadays. Just want to let you know that.
I feel honored. Thank you, Director. It's been a pleasure. Thanks.
Thank you. Matt, any questions?
Let's see, Ben.
I'm sorry, Ben, any questions?
Director Hayward, now I'm going to call you Director Hayward instead of Mark because I'm so hurt by that. It's been a year and a half,
because Matthew from my staff does our Mondays with Mark, and Governor, we still want to have you on Mondays with Mark. We had the general treasurer on this week, but I'm sorry, and that's Matt. So Ben, I'm sorry. Were there any questions?
It's okay. No questions. But I do want to say that if you want like a more in-depth, last week the Small Business Coalition forum where they go in depth with the director last week was Director Hayward, and he answered a lot of questions in that, and that was a wonderful conversation as well. So there's tons of and Mondays with Mark. There's so many things to find out more info on the SBA stuff. So thank you.
I'm sorry, Ben. Mea culpa, mea maxima culpa.
It's fine.
Thank you,
Governor.
It's been a pleasure. Thanks. So next, we're going to go with Matt Weldon, the Director of the Department of Labor and Training. So we want to hear from Matt how things are going. And I just want to put Chris Parisi on cue. Chris, I met you earlier. You're an expert on co-hosting this event. And I'm in a location that my internet may fault. So please stay tuned, all right? So let's hear from Director Matt Weldon. See how things are going with DLT right now.
Hi, Governor. Thanks for having me. I'll be super quick today. So we talked a bunch about the changes that we made to unemployment to let people get back to work, earn more money, keep more of what they earn, stay connected to the federal 300, and get a job now. Because right now, the most important thing for Rhode Islanders collecting unemployment is to get back to work. Because September 4th, the federal programs end, and that's not just the PUA program for the gig economy workers or self-employed people. It's also all the extensions that people on regular unemployment are on and the extra $300. A lot of people, like 70% of the people collecting benefits, will see their benefits end on September 5th. We need to get people reconnected to work. So we made those changes. They were effective May 23rd, and it's absolutely working. 1,411 people have been able to qualify for a partial unemployment payment that wouldn't have qualified if we didn't change the law. And so those people are back to work. They've now gotten payments, and those are individuals. They've done it in multiple weeks, but that's 1,400 different people. That's a big deal. 1,657 people have reported to us that they've earned more than 75% of their pay before they filed, or more than 150% of their weekly benefit amount, which basically means they've returned to work full time. In addition to that, there are people that have definitely gone back to work, but it's really hard to track because if they don't report to us that they've gone back and they just stop collecting, we know that why would they stop collecting unless they've gone back to work? They have eligibility through September. We know they've gone back, but unemployment always has new people coming in and older claims going out. So it's tough to track that way. But we know that 1,600 people have gone back full time. We know that 1,400 people have been able to earn more than they could have before. 6,919 people have kept more of their earnings because of the changes we made. I've spoken with you and Governor McKee about maximizing family income right now, getting people back to work and letting them keep more of their money. Almost 7,000 people have been benefited by that. That's great. The big thing I want to talk about for just a minute is we have a virtual career center at backtoworkri.com. Employers can register with Back to Work RI for free. We can provide services where you can post jobs, you can have virtual career fairs, you can find candidates, and we can help you do matching. We have a multi-employer career fair tomorrow from 9 to 11. There's different industries, different employers. We're trying to let people know, go in. You have to look for work if you're on unemployment. Go to these career fairs, participate. You can get an individual time slot, 15 minutes, one-on-one, just like you and I right now, Governor, on this screen, one-on-one. We can talk about jobs, and we can maybe have an opportunity for a new job for somebody. That's important. It's free. It's all done online at backtoworkri.com. That's it for me.
Thank you, Director. And again, it's very important to remind everyone that starting September, the federal benefits are going to go away. You don't want to be left without having a job at that time and starting the process of finding a new job in September when you're not going to be getting any income at all. It's better if you start working on that right now. So please reach out to the DOT team and make sure that you're starting to search for a new job right now before September comes. So thank you so much, Director. Well done.
Thank you.
Great seeing you. So now, Ben, do you have any questions? I didn't check with you before I told the director that he was all set.
Nope, no questions for Matt today. But I, just to remind everybody, you can use the chat function on Facebook to ask your questions, and we will ask them live to the directors and the panels and the lieutenant governors. So feel free to use that and be a part of this. It is a community town hall.
Thank you. And I just gonna take one moment. I want to say something in Spanish because I've been inviting a lot of Spanish-speaking business to join us. So, si ustedes tienen alguna pregunta para alguno de los directores, por favor, pongan la pregunta en el Facebook chat. Hagan su pregunta ahí. Okay? So, if anyone has any questions for any of the directors, please put that question in the Facebook chat so we can pass your question along to the directors. Okay? Thank you. So with that, and now I want to welcome Chris Parisi. Chris, I need you to help me co-host moving forward. Are you ready?
I'm ready.
Thank you. Thank you, Chris. So Chris is the founder of the Rhode Island Small Business Coalition. So thank you so much for all your hard work. Thank you for keeping the conversation going every week. I'm so grateful that you're always there available to help us keep the conversation going. So next, we're going to start a really good conversation, right, Chris?
Yes, I'm excited to see we're now bringing on small businesses. The Lieutenant Governor's office, you and your team are bringing on some small businesses. It's great to hear directly from them to show the experience that they've had and how we've all had to be very resilient and innovative and transformative. And that's how we were able to survive, in addition with a lot of the, government programs that, federally and at the state and local level. So I'm excited to hear more about this, the new business owner from Frog and Toad and also the director from HealthSource RI.
So Ben, can we bring them on? Let's bring the director, Lindsay, Kristen, Areson. Okay. All right. Are we ready? Welcome, right. Director.
Thank you so much for having us.
Thank you. It's my pleasure. I'm so glad you're here. You have important information that our small business community needs to know about. Can you share some of that information with us right now?
Gladly. So thank you so much for having us. We're Kristen and I are here from HealthSource RI, and we're the state health exchange for the state of Rhode Island. We serve individuals and families on our individual program, but I'm here today to talk about our small business program, HealthSource for employers. We serve a little under 1,000 employers with over 6,000 members. And as the folks who spoke before me talked about, this has been an incredibly challenging year for small businesses. And we are we just wanted to come on today and talk a little bit about what we offer, how we connect small businesses with high quality, affordable health coverage, which we all know is more important than it's ever been before. And just talk a little bit about how we partnered with our small business community this year to help them navigate, as Chris was mentioning, a really tough year in which small businesses had to be even more creative, more resilient, more hands-on and innovative than they've ever had to be before. And we're just really proud of our small business customers and our team who've worked hand in hand to help them navigate all of those challenges this year. So like I mentioned, HealthSource runs a small business program. We offer different choices of commercial health insurance through HealthSource for employers. But one of the most interesting things and something that sets us apart is that we have a small business engagement team that works one-on-one with the employer and sort of meets them where they are in terms of what they need. We know that small businesses can have a human resources department or one person who's dedicated to helping manage employee benefits. But as we think about the coming year and the moment that we're in, employee benefits are a huge part of retaining employees, attracting employees. And so I want to make sure to talk about how we help support employers and employees in that work. We have this small but incredible business engagement team. We have Kristen Areson, who leads our sales, and they essentially are a one-stop shop. We will work with a small business if they have a broker. We're happy to work in partnership and sort of follow the lead of the broker. But if a small business doesn't have a broker, that's fine too. We will meet the small business owner where they are. Whatever they need, whether that's coming on site and helping walk them through all of the different health plans. We will sit down one-on-one with their employees and help support them in their decision in terms of the best health plan for them. And one of the most unique things that we offer that you can only find through HealthSource for employers is this thing called a full choice model. And I just want to spend a few minutes talking about that because I think, sort of price predictability and choice is always important for a small business. But as they navigate really unpredictable economy and face some of the challenges that we've all seen in the last year and in the year ahead, no doubt, price predictability with respect to health coverage is really, really important. And so what this full choice model means is that the employer can choose one set amount that they are willing to pay towards their employees' health coverage. And then that price doesn't, that's sort of what they're locked in for. And their employees can then take that amount and put it towards the plan that works the best for them. So for some employees, who may have more healthcare needs, they may choose to buy up, we call it. So they'll contribute a little bit more of their own money on top of what the employer is willing to pay to potentially buy a richer plan. For others, the plan that the employer chooses is going to work just fine for the employee, and that's what they'll select. And maybe they'll even go down and buy a less rich plan. So having that kind of price predictability for the employer has been really important. Kristen can correct me if I'm wrong on this, but I think maybe 80-90% of our employers ultimately choose to use the full choice model. They only have to write one check to HealthSource, and again, they get that predictability in cost. So we found that going through HealthSource and using that full choice model has been a really popular option. So in addition to that, this past year, we've just really been working with our customers to ensure that they have all the information that they need as they navigate, layoffs, as they navigate reductions in income, as they're applying for loans. Make sure that they have all the information about their health coverage that they may need. And in the unfortunate event that there are layoffs, we have a rapid response approach. Working with Director Weldon and his team at DLT has been great this year. We've made sure that anyone in Rhode Island who's receiving unemployment insurance is also getting information about their health coverage options through HealthSource RI. And for our small business customers, and I will say there have been very, very few who've had to make the hard choice to close up shop or discontinue offering health coverage. But I do want to just mention that in the unfortunate event that happens, we will work hand in hand to make sure that employees or even the business owner are aware that they can go over to our individual and family side and get enrolled in health coverage through HealthSource RI. So Kristen or Asher, do you want to fill in and add to anything that I shared so far?
I would just say the two biggest questions that I always get when talking to small business owners is, one, how does my business qualify? Am I a small business? I was talking with a business owner yesterday and he said, "Oh, I'm not a small business. I have 30 employees." And I said, "You truly are a small business. So what defines a small business for HealthSource Rhode Island for health insurance needs in Rhode Island? If you have one unrelated employee all the way up to 50 employees. So we are able to help you work with your health insurance options all the way up to 50 employees. So I know a lot of times people think 10 employees, what defines a small business? So please know that it's 50 employees or less. We have the capabilities to help you and to work with you for that amount of employees. And then the next question I always get is, "Oh, I could never afford to provide health insurance for my employees." So for that, I say, let us be able to at least provide you a quote or a walkthrough the way that the system and the policy works, and how you would pick the defined contribution model that Lindsay went over. And so that way you can see if it is something that would benefit and would work for you and for your employees, because we truly want to be able to offer options that work best and are helpful to all employees. So it just works with a small contribution model if it's just that you're able to provide. So that's just what I wanted to add, is really the two biggest questions that I have continuously here.
That's a great point, Kristen. We have had companies who've asked us to come out and give them a quote, and maybe they want to chew on that for a couple of months or even a year. I think we've even had small businesses who we've sort of kept in our hopper for a couple of years. Maybe it's not right for them right now, but having the quote is information they can use. They can always come back to us in a future year, and we're ready to work with them when they do.
Wonderful. Thank you, Kristen, and thank you, Director Lang. When it comes to healthcare, I mean, that's a big expense for our small businesses, as we all know. So anything that we can do working with a great organization like HealthSource RI to allow us to be competitive with those bigger businesses and still provide those essential services to our employees is just so great. So we urge everyone to go to hsriforemployers.com to learn more. But let's hear from Asher. I know it's Titanic Tuesday today. If anyone's not aware, 50% off some amazing goods. So Asher, if you want to tell us a little bit more about your business and how you worked with HealthSource RI.
Yeah, thank you, Chris. You're an incredible hype man. Thank you. We could use a guy like that on our team. I'd love to just thank the Lieutenant Governor for having me on for this discussion today. And of course, thank Lindsay and Kristen for all that they do to provide great healthcare services to businesses here in Rhode Island. I'm so honored to be able to speak anecdotally about Frog and Toad's story over the past year and a half. It's first of all, congratulations to everybody that we're able to sit here doing like a post-mortem on this pandemic that we've all weathered. I mean, it's really exciting to be able to have that positivity right now, but also to look at the practices and policies that we may have adopted over the past year that were successful and that we need to look at implementing for the longer haul now. That's a conversation I'm really looking forward to having more. But for now, just anecdotally, I don't know where I would have been last year without HealthSource RI. First and foremost, to have my business get on board with them and experience firsthand that customer service component that they offer compared to all of the other healthcare experiences that I've had professionally was just such a revelation. I can't even believe that there are Rhode Island businesses that might not yet be taking advantage. When March hit in 2020, and I think we could all see vaguely what was coming, I think there was this shared dread, this existential crisis that maybe we were in. And as I realized that I needed to lay off my staff, it was really a feeling of terror, because emotionally they're like family, but from a business standpoint, I knew that Frog and Toad was going to be in some serious trouble if I couldn't retain them after having laid them off. So speaking with Fran Thuot over at the Small Business Engagement Team with HealthSource RI, we put together a plan really quickly, really easily for what to do with our staff so that they could retain their coverage. Before getting to that point, we were selling stickers. We were selling stickers where 100% of the proceeds were going to be going to fund our team's healthcare in the coming weeks and months. And we raised $5,000 because the public cared and wanted to make sure that my staff was covered for healthcare in that time, which was just incredible. But Fran was able to get us connected. We had Zoom meetings just for myself and my staff. We got HealthSource RI for individuals connected for all my staff. They went through the neighborhood health plan. So nobody had a lack of coverage. And then when staff came back online, they were all implemented back into our regular plan in November of 2020. So we had this huge gap there where we were able to save money, basically, and not pay for healthcare throughout the whole term. And then be able to bring them back on with no consequence. And it was this huge thing to be able to have that roadmap laid out for us and know what to do in that time. So when everybody came back off of coverage, their jobs were still there, and the team that I rely on so much wanted to be back at work, wanted to be back on the team, and I certainly couldn't have afforded to lose them. And then that sticker that I mentioned that we raised $5,000 with, I didn't need to spend that $5,000 on healthcare, so I was able to set up a 401k plan for these same staff members. So it was just this amazing sequence of events in a terrible time, and I'll always be grateful to HealthSource for that. And I would also like to use this microphone to say that the Department of Labor and Training was an incredible resource for me as a small business also, just to be able to navigate the unknowable and to know how to direct my team to take care of themselves in that time where I wasn't going to be able was just amazing. So thank you, and I'm sorry for going on for so long, but I speak from the heart, and I really had an incredible experience.
Oh, that's a wonderful story, Asher. We appreciate it. Do not be apologetic. That was great to hear, because sometimes you need to hear those inspirational stories that when times were at the most very bottom that we all experienced in March, as small business owners, you're just trying to figure out how to survive day to day. So having someone like HealthSource RI actually sit down with you, develop a work plan, and figure out, because of your compassion, to ensure that your employees are retained and taken care of. So not only from a personal standpoint, but professionally, that when things are rocking and rolling, they'll still be around. It's just great to hear. And that's sometimes government gets a bad rap, right, when it comes to business communities and small businesses. But, working very closely with the Lieutenant Governor's office, with the Governor's office, you're working very closely with HealthSource RI and everyone that's been so helpful at DLT throughout this whole process. We talked about Director Hayward at SBA, Liz Tainer at DBR and Commerce Secretary. prior. They've been so incredibly helpful to our small business communities, and working with them, especially talking about HealthSource RI, is able to give the small businesses that competitive advantage to ensure that we're helping and retaining our employees. So thank you for sharing that story. And I just want to pass it over to Director Lang if you wanted to add anything to that, or just also remind our small business community the best way to get going, to get started, to work with this program if they're, a business that has 1 to 50 employees.
Great. Thanks, Chris. I think if you're Asher's hype man, Asher, you're going to be our hype man. So maybe we'll have to come up with a new sticker. But, no, I think I really do think the best way to message what we do is to hear from our customers, because they're the ones sort of walking the path of being a small business owner, having experienced sort of that gut-wrenching feeling of seeing what's coming last March, living through it, and having to make these hard decisions about their employees who are often their family members. That's one of the things that we hear all the time from small businesses, is that their employees sometimes are in fact family members, but if not by blood, they sure feel like it. So it means a lot to us, Asher, to hear that from you. I'm sure our business engagement team is also watching. And so thank you for sharing your experience. I think that's really the best advertisement and the best example, really. The best way to reach us, if there's a small business just interested in getting started and learning a little bit more, is our phone number or our website. Our phone number is 1-855-683-6757 or HealthSourceRI4Employers.com. And we're really looking forward to helping anyone out there who needs to connect with health coverage to do that. It's more important than ever. And if you're a small business or if you're an individual, contact us and we will help you sort it out.
Thank you, Director Lang. I'm going to connect with you, so making sure all of our small business members in the Rhode Island Small Business Coalition are aware of this great program and taking advantage of it. So we'll chat offline. And looks like Lieutenant Governor is back with some internet. So passing it back to you, Lieutenant Governor.
Thank you so much, Chris. Great discussion. Thank you, Director Lang. Thank you, Kristen. And Ashlyn, I just want to say thank you for that testimony that you just gave right now. And I want this message to go to all of the state employees, because sometimes we don't hear the good story. We hear when something goes wrong, but there's so many hardworking people working every day to improve the life of Rhode Islanders. So it's so good to hear a testimony from you. And on another note, I have to say thank you for keeping my spirit up with all your tweets. I know your messages on the delivery of the t-shirts, that helped me to go through last year. So thank you so much for that. Thank you.
Thank you so much.
So I'm gonna now, we are at the end of this broadcast for today. I wanna thank all of you that joined today. I just want to remind you that we're going to have the next one is going to be on July 6th. Is when we're going to get together again. I'm going to be with you. And for the July 6th, we're going to be talking about an important topic, and it's how you can make your small business accessible, ADA accessible. So we're going to have Tina Penderson with us. She's the founder of RAMP. It's a Real Access, Mobility, and Progress. And also we're going to have Anthony Santuri, the owners of the Free Play Bar and the Arcade in Providence. And they're gonna show us how it's so easy to be able to make your small business ADA accessible, and the difference that it makes, and how you can be able to serve more customers. There is a lot of customers out there waiting to come to your business, but all we have to do is make sure that your business is accessible for them to come in. So with that, I want to thank everyone again for joining us today. Ben, any question before we go?
Nope. Wonderful job. Thank you for still continuing to do the show, even on the road and in the middle of what is becoming an even more hectic schedule.
It's my pleasure. I will not miss this for anything. And thank you to you for your work. And thank Chris Parisi for jumping in to help me co-host today and doing the broadcast the days when the weeks when I'm off. So thank you all for watching and have a great rest of the day.